We're moving forward to chapter 11. This is counseling children and adolescents. You do touch on this in a few of your classes, but you do not have a specific class on this. If you're really interested in moving in this direction in the future, I would suggest lots of training in counseling children and play therapy. The learning objectives for this chapter are to discuss the mental health issues that affect children and adolescents, understanding developmental, biological, contextual issues that contribute to young people's mental health, describe effective ways for working with children and adolescents, and understand specific concerns young people face, including depression, eating disorders, ADHD, family disruption, grief and loss, and maltreatment. You also are going to get a good number of these in that lifespan development class that I mentioned earlier today in the previous lectures. There are multiple factors that affect children. We know that children have a whole host of issues. Primarily, we understand that adverse childhood experiences, the ACEs, that we studied in our earlier classes, have a profound effect on the development of children. We know that the families that people are raised in, that these children are raised in, and the traumatic things that occur cause disease. They cause mental health. They cause severe physical issues in the present time and then in their future lives. So it's extremely important that you understand all these different factors that affect children, such as poverty and trauma. Really being able to look for those things as risk factors for children when you're counseling them. Now, there are certain developmental theories, just like when we talked about marriage and family. There are different theories that primarily you use with children. So these developmental theories are the ones that we'll talk about not only in this short lecture, but then again in lifespan development this summer. You'll remember as I reference these when we go back and talk about um, all the different Erikson, Piaget, Kohlberg, Vygotsky. You'll hear about all of them in the lifespan development, and these are the ones that work best with children. So make sure that you know that table on 11.1, just understanding if I gave you a test question that said all of the following are connected with counseling children, theories are connected with counseling children, all the following accept. To make sure you just have a good idea of what those are. So just look down and kind of memorize the different theories that go with counseling children. So we know that there's different stages of development with children. We talked about this in the theories class. We talked about Erikson and the stages of development. So if we start in early childhood, this is usually between the ages of 2 and 6. Now, in lifespan development, we'll also go through pregnancy and also in utero and up to 2. So we will cover that as well. But this is the stage of development in early childhood when there's motor skills refinement, development of ties between peers, and expansion of thoughts and language. There are two theorists that are primarily responsible for the development of theories in this in childhood, and they're, I said earlier, Piaget and Erikson. So just so you understand the context of what is happening. So we have the early childhood, and we have both theorists. We have Piaget, who has a stage constructed theory of cognitive development. And then we have Erikson, which is a psychosocial theory. And it provides another way to understand children's development. So if we take Piaget first, this is called the pre-operational stage of cognitive development. And what Piaget found in this early childhood stage, children are likely egocentric, may attribute lifelike qualities to inanimate objects, can represent and recall feelings, their emotional self-regulation begins to improve, um, they develop the ability to represent objects and events through imitation, play, drawing, and spoken language in their playtime. And then we have Erikson stages, and you may recall this from theories from the psychoanalytic chapter. This is Erikson's psychosocial theory. And in this stage of development, he says it is initiative versus guilt, that we have to really help children to find their initiative to be engaging and make choices, to be have some power versus not allow them to explore, not allow them to do things, to go and make things and play and have those times to experiment. When we don't allow that, then they become a guilty ridden. And you could trace this back a lot of times in your work to that stage of development where they've had an issue. And then we talk about middle childhood. This is ages between ages 7 and 11. And there's different characteristics that key you in that this is the stage of development. Children at this stage increase their literacy skills, their logical thinking. They're able to negotiate relationship with peers. They learn how to get along with their peers and learn patience. Um, so that we've got Piaget again and Erikson talking about middle childhood. In Piaget's cognitive development, this is the concrete operational stage. And at this stage, children are capable of reasoning logically about concrete, tangible information. They can get those logical concepts, and they still have difficulty reasoning about abstract ideas, but they learn best through questioning, exploring, manipulating, and doing. And then in Erickson's psychospatial, he talks about this stage as industry versus inferiority. When you're helping children to feel empowered and gain mastery over tasks, they learn to be industrious. But if we do not help them to be have self-efficacy, then they have feelings of inferiority. So if they're not able to manage tasks and grow in that area, they can become inferior, feeling inferior. Then you move into adolescence, just like it says. There's a very large emphasis on peer groups. Um, Puberty occurs and marks the beginning of adolescence and Piaget's cognitive development. Usually not until 15. It's the formal operational stage. And this is where you can really start to think of more abstract concepts, um, capable of more complex knowledge and problem solving. Very egocentric in this area, constantly on stage or playing to an imaginary audience. And Erickson says this is identity versus role confusion. If you don't figure out your identity in this stage, you become essentially lost in your confusion about who you are and really struggle in the future with trying to figure that out. There are biological considerations for these stages of development. And then Bronfenbrenner is also a lifespan development theorist that we'll talk about in that class. And he talks about the 5 interactions with the bioecological model. And we know that teens are very egocentric. So why is this helpful for you? So be thinking about the unique characteristics of each population that we're discussing in the PowerPoints and think about why would you need to know this if you're seeing children or teens? What is it that you need to know about their development so you can make a determination on what's normal, what's abnormal, what to expect, what developmental milestones that client should have met, um, and what's normal, because sometimes if you don't know these things, you may think something is abnormal, but it's really normal. So in adolescence, we also, I think I already mentioned this because I did a pause and an edit on this video, so bear with me. I think I already talked about this. I had to pause it and get back on, but um, identity versus role confusion. So you see people who grow up and they never have found themselves. They had a crisis in with Erickson's stages of development. You go through a crisis and you don't resolve it. So if you resolve it, you find yourself, you find who you are. But if not, you become very confused and it stays that way sometimes until forever. But a lot of times the clients in substance abuse and drug court, when they would come in, they would be stuck here because I usually would start drug use sometime in the adolescent phase, and that really stops your emotional development. Yes, you sort of chronologically age, but emotionally stay about the age of a teenager. I mean, I literally had a substance abuse class. I think it was funny one time to lock me out after the break of the classroom. And these people were like 20 years older than me at the time. Um, I mean, I took it with a grain of salt, but it was hilarious because really something a child would do. I mean, we're in a class, an adult class. So, um, and you can over-identify with heroes or cliques in this stage. I talked about this already. I know because I was on Brothenbrenner. Now I remember. Sorry. Um, so bioecological considerations to think about. So psychological, biological, and genetic influences are always something to consider when counseling people. Temperament, what is the actual temperament of the child? What is their emotional style, their attention span, their activity level? Are they easily excitable? Are they calm? And what is going on within them and then in that family system? You always have to look at the family with kids, no matter what. I mean, you may not counsel the family, but you have to look at the quality of the relationships with the family, which is also listed here. The cognitions, always making sure, how are they processing information? Um, are they successful in school? Are they not? These are all things you need to know about. And then they also have these, they can have faulty cognitive processing skills, which is attributional bias. So that's something you need to know. Um, this can cause adolescents to be really aggressive toward a certain group of people. They maybe have trouble in school because they have no power in their lives. So they try to get their power back in school, and they're not very adaptable to situations like in school and with peers. Um, Genetic and environment both influence behavior, and there's definitely these other contextual influences, um, like the family that we can't, a lot of times we can't do anything about, the school. I can't tell you how many times um, I get into a situation with a child and I find out that the teacher is a huge part of the problem. Um, we've all had that teacher that has really influenced us in a good way, but we've also probably had the one who's influenced us negatively. And if we have a negative teacher who's speaking things to our children or our clients who's not positive or supportive or uplifting, that can really affect the child. And so sometimes there are issues such as that. There's also peer influence, and then of course cultural influence. There's systemic racism. There's the cultural influence. There are things that we need to think about how maybe the child is being treated. What's the cultural influence? What's going on with the child? What's happening in their own culture, and then what's happening in the other culture. So basically, looking at that in a systemic way, how all those systems are interacting and affecting one another. There's also different kind of parenting styles. It doesn't look like it's in these slides, but I want you to know them. So it's this is one of those times where Dr. Beal is going to say something that's going to be on your final. I want you to know these parenting styles: authoritative, authoritarian, indulgent, and neglecting. Those are attachment issues. Kids who have attachment issues are going to have the neglecting um, parents or the authoritarian parents, sometimes indulgent as well. Um, the authoritative is the most positive parenting style. So that's the one that has the best outcomes for later on in life. You're going to see Brothenbrenner again. Brothenbrenner is in lifespan development, and he has this bioecological model. There's 5 interactions, so there's 5 systems, and you need to know these because this would be a great test question. Microsystem, mesosystem, exosystem, macrosystem, and chronosystem, the time. Okay. Now, I don't see in your text, I'm looking for the cool little model that they may have. I don't see it. Rothenbrenner has a great little diagram. It's on 11.1, but in the Lifespan Development book has a great circular diagram showing the systemic relationships and how they interact. So the microsystem is a specific environment in which the individual develops, such as family, peer group, school, church. The mesosystem is the interaction for 2 of those systems, right? So school and family, or school and church. So we were already kind of talking about this just a minute ago, but think about how those systems interact. Exosystem, the context that exerts an indirect influence, like if I have a really stressful work week at the college, and I'm working, that's going to affect my children. It may indirectly affect them because I'm not as attentive or engaged. I mean, there's other things that are indirectly influencing the system. And then going down to the slide two, macro system is that overarching belief system or culture that it affects indirectly through cultural tools and that right now, if you think about all the different things that are going on right now, there's different belief systems in a more of a global culture. And the chronosystem is the evolution of the four systems over time. So you need to know those. Go ahead and memorize those for your final. Um, I know that you hopefully won't watch this until after your midterm. That would be the best thing, so you'll get confused. Because the final will be over um, 9 up, chapter 9, 10, 11, and up. Normative and non-normative life events. So there are normative life events and then there are non-normative. So kind of what do we normally expect to happen? We expect puberty to happen. We always have these merging sexuality, school transitions from like elementary to middle and middle to high school, college, if you go to college, and then non-normative like divorce, death of a family member. Those are things that, kind of unexpected that occur. And so what do you do when you're counseling kids? Same thing that you do somewhat with adults. You get that relationship established, you clarify the goal, and explain confidentiality. Uh, you use assessment and evaluation, but you look at all the things that we just talked about. Right here. You want to look at all that. You can even write that down. You're going to use informal assessments. And how do you design and set up a treatment plan? And let's talk about confidentiality for a second. The way that I do this with my kids and teens when I'm seeing them, it's right here, explaining confidentiality. Um, I do exactly what the book says. So that was good to get another, this is a new text I'm using with you guys because last year I got some complaints about the textbook and I did wholeheartedly agree with those complaints. I'm very happy. I like this book better. It's much easier to follow. But I always like to, when I'm reading and preparing for lecture, I'm always glad to hear when I'm doing something correctly. So um, I explain to the parents when they come in, we do the first session together, and I always let the parent know, hey, I would like to be able to work with your child as much as possible, confidentially and safely and privately. If your child brings up something that's harmful to themselves or others, I'm really concerned about their well-being, um, I'm going to tell you, and I say that in front of the child, and I tell the child, look, this is the deal. I want you to be able to talk to me about whatever you want to talk to me about, but some things I may have to tell mom or dad. And then sometimes you might bring up something that I just think could be helpful if we told mom or dad for your relationship that they may need to understand or facilitate a conversation between the two of them about feelings, working on the family relationship. I'm not a family counselor, but I do bring in stakeholders in the family every once in a while to help meet a goal. Meaning, I may bring in mom or dad, or I may bring in sibling for a couple of sessions for one goal to meet a goal. So I don't become a primary family counselor. I stay the individual counselor. And that works really well because a lot of times the kids, they'll even say, like, I'm going to go out while you tell them this, but I trust you, Dr. Veal, that you're going to tell her just this and not all the other stuff we've talked about, or tell him. And it works. It really does. You don't ever want to break the trust of a teen. I think that's in here, but man, they won't tell you anything. Again, if they think you violated that trust. But all the things we talked about in this chapter are the things you need to know. Where are they developmentally? What are their relationships with family, friends, school? What are their strengths? What are their limitations? You want to give formal and informal assessments, design and implement a treatment plan, and ask questions to the following areas, which is like solution focused right here. What could be different? What's going well? What's getting in the way of solving the problem? What specifically does a child want to change? What has already been tried? And that's how you try to decide what kind of interventions you're going to do, because um, you do need a lot of activities with children. You can't just sit there and talk the whole time. You've got to have something going on. You got to be drawing or playing with sand tray. You've got to be doing, we have this Jenga with questions, but you got to be intentional and flexible with that treatment plan. There may be different ways to get to the goal that you're trying to work on. You got to be, oh, that's the next section, creative interventions. You've got to be creative, expressive art. This is where you're really going to be into just tons of creative. Look at all this art, music, play, puppetry. We have all this at the practice. Storytelling, drama, bibliotherapy. I have a therapeutic playroom at the Veal Group, and it's pretty awesome. But there's all sorts of ways that you would use this even with teens, because they're not just going to sit there and talk to you the whole time. I mean, they can, but you got to be creative. So those of you who are into art, a lot of you are really into art. This is where, I mean, you would use your artistic skills and creative interventions every week, every day with kids and teens. I mean, you would be doing drama and art, and there's the sky's the limit for what you could do here ethically, without issue. I think some of you have been interested in that. So here's a great niche for you if that's what you're into. And of course, the concerns affecting children and adolescents. We're just touching on this. Um, but read through this. It's very important to go ahead and get that base knowledge for you. That's what this is. This is just getting you the basic knowledge before we even build on the knowledge. But these are the issues. I would say number one would be divorce. Number two, depression and anxiety. I don't see on here is like probably depression and anxiety, number one or two. Eating disorders, ADHD, trauma, lots of trauma and grief and loss, substance abuse and cyberbullying, constant, awful. Thank goodness we didn't have that when I was growing up. I don't know what happened to me, but yeah, this is a great chapter. Fabulous chapter. Lots of good information. Talks about antidepressant medications. Um, Make sure you read through that too. Antidepressants on kids. Make sure you read through all the back here in this chapter. Um, on child abuse, child neglect, on page 290. Make sure you read through that grid, please. All right.